Hello and welcome to Case of the Day. I'm Dr. Crowley, and today we're going to discuss something that some people might think is a little gross, but some other people might think is a little funny and interesting. So we're going to discuss what's called Demodex, which is a tiny little organism that actually stays around your eyelashes and burrows down into the follicle of the lash, and then at nighttime crawls out and can crawl across your face and around your eyelids. And there's even some evidence that Demodex may be a cause or part of the cause of rosacea, that as these things crawl across your face and then die, their body fluids cause a reaction on your skin which could lead to rosacea. And so there's some studies have shown that as well. But we see a lot of people who have Demodex, and it's more commonly it's around the eyelashes. And basically what happens is that people who have blepharitis, that is, normally your eyelashes are nice and clean, but in people who have blepharitis, they got crusting and mattering all around your lashes, and the glands here are infected in the lid, and it's a chronic disease in a lot of people. An old term used to be granulated eyelids, and so blepharitis is very common, and people sometimes have it for years and just never really do much about getting rid of it. And so Demodex occurs in a lot of people who have this blepharitis, or if you have red itchy eyes, you could have Demodex in your eyelashes. And the Demodex is a tiny little organism that's about 1/3 of a millimeter, like almost microscopic in size, and all sort of semi-clear looking, has 8 legs. And so I'm actually going to show you a model of this. So this is a big model. So you have this thing a lot smaller, but crawling around inside around your lashes and across your face at night. And so this Demodex burrows head down into the hair follicle or eyelash follicle, and then supposedly they're still not known for sure, but feeds on either cells or tissue down in the hair follicle, and then comes out at night. And then their life cycle is pretty short, so they reproduce on your skin, and then they die, and then the body material, waste material, is then causes inflammation, and of course them being there and ended down in your lashes cause inflammation as well too. And so this, like I said, is a close member of the spider family or arachnid family, and so they're sometimes very difficult to treat. We have a new product that just came out on the market, and so to try to clean lashes off. So we have this little, looks like a little drill or pin, and on the end of it, it has a little sponge. And so it's a tiny little sponge, and it spins around like a drill, and we can clean all this stuff off your lashes and lids, and then get all this matter cleaned off, so then you can get down to the Demodex. And we use an antiseptic soap that can even kill them somewhat. Some treatments also are tea tree oil application to the lids to kill the Demodex. And another way you can try to control it is to really goop up your eyelids with an ointment at night, and then sort of trap them as they come out at night into the ointment. But the main thing is just keeping your lids really clean. So we have some cleaning pads called OcuSoft that are an antiseptic pad that cleans off the lashes as well. And so anyway, so you don't realize it, but you know, a lot of people have this, but you have this stuff crawling around on your lashes and lids at night. And so for some people it's pretty gross, but it's extremely common in some areas. So anyway, if you have red itchy eyes, you may want to have your eye doctor to check to make sure that you don't have Demodex in your eyelashes. So then if they're not visible on the surface, you can always pluck out an eyelash and see if they're down in the hair follicle. So that's another way to diagnose it. So if you have red itchy eyes, you might want to get it checked. You might have that Demodex crawling around there. Otherwise, may God grant you with healthy eyes and great vision. Have a great day.